Welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. My name is Tim Sheehy. I'm president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. Our special guest today is JOE KIRGUES, co-founder of Generator, a nationally ranked accelerator that invests in high-growth startups. And if I have my numbers right, they've invested in more than 95 of those who have gone on to raise $300 million in follow-on financing. So Dr. Raymond, let's start with you for an update.
Okay, Tim, thanks. If I could have the first slide. Since we began providing updates about 4 weeks ago at the Daily Brief, we've been tracking the daily growth rate, doubling time, and the number of new positive COVID-19 cases each day. Those metrics have shown positive effect of safer at home and voluntary social distancing interventions, with improved doubling times and daily growth rates, and a general trend of flattening of new cases is shown respectively on the left and the right panels of the slide. And if you can't see those on your screen, they should be available in our handout. 3 major milestones occurred within the last week. There was a significant increase in the number of tests being conducted. The Badger Bounce Back Plan was introduced by our governor last week, and earlier today, the Department of Health Services issued emergency order number 34 to turn the dial by allowing curbside pickup for non-essential businesses, rentals of outdoor recreational equipment, and car washes. And with the increase in testing, we do expect to see significant increases in the number of COVID-19 positive patients and a worsening of the metrics that we've been following, largely due to the increase in testing. So while these have been valuable metrics to evaluate the growth of the virus as we were going to flatten the curve, we're not going to be able to focus on them as much because we're going to need new metrics as we watch the curve go down. And as I stated in Friday's Daily Brief, we plan to introduce some additional metrics for us to align with the Badger Bounce Back. Next slide, please. The Badger Bounce Back Plan provides a thoughtful framework to address the twin threats of COVID-19 posed to our health and to the economy. And because the Badger Bounce Back Plan introduced new gating criteria and scorecard metrics, we're going to be aligning the regional data with the state's gating criteria going forward. And Wisconsin's Safer at Home extension provides more flexibility than many plans in surrounding states. But this flexibility does come with some risk, and most of those risks are addressed in the Badger Bounce Back Plan. We need more testing. We need better public health surveillance, and to have that public health leaders have the tools that they need for surveillance and tracing. We need to increase our efforts in communities of color and other at-risk living and working environments. We need to help our employers protect their employees and customers so that we don't need to revert back to crisis standards. We need mitigation strategies and triggers to impose higher levels of restriction if the data show that we're at risk of another surge. And we need our citizens to know what it means to live and work responsibly in the midst of the COVID-19 pandemic. Next slide, please. This slide shows one set of BBB gating criteria for the trajectory of the pandemic. With a significant increase in the number of tests at the end of last week, the number of positive cases per day has grown and will grow, as you can see on this slide. Positive tests for each day are depicted in pink, and the total tests administered are depicted in the light blue bars. This potentially confounding effect of increased testing can be minimized by simultaneously tracking the percentage of positive cases as shown in the black lines on each of the panels. And these are Badger Bounce Back gating indicators. We plan to begin tracking these data going forward for both Milwaukee County and for the state. And we do expect that the variability that you see in Milwaukee on the left panel to smooth out as we increase testing. Another set of gating criteria involves steady declines in the number of cases of influenza-like illnesses and COVID-19 syndromic illnesses, and we will begin to track those soon. Next slide, please. There also is a set of gating criteria for hospital capacity, and those are under development. But today I'll show you two potential gating criteria that we've been sharing with you over the last 2 weeks. The first is an adequate supply of PPE. And we've consistently discussed that shortages of personal protective equipment are current and future limiting factors for treating COVID-19 and for hospitals to resume even a modest level of elective procedures. Although there are serious supply chain issues for PPE, you can see some recent improvements shown by the downward trend of the number of hospitals in our region on the left and in Wisconsin on the right that have critical shortages of PPE as measured by having a 7-day supply on hand. But as we know, PPE shortages will remain a significant challenge for us going forward. Next slide, please. This slide shows ICU hospitalizations since April 12th in southeastern Wisconsin and in the state. Because Wisconsin has successfully flattened the COVID-19 curve, we have not yet exceeded our non-surge capacity for ICU beds. And the trends are going in the right direction with a slow decline in COVID-19 related ICU admissions. And to reiterate, ICU capacity remains a relevant hospital metric to monitor, but it is not a currently limiting factor. Next slide, please. On this final slide, I'd just like to point out a few things. As we move out of crisis and into a new phase, our individual and workplace choices matter. We will be living with social distancing for the foreseeable future. And despite our progress, we must be mindful that COVID-19 has a very high rate of transmission. And without a vaccine or an effective treatment, our only tools are physical or social distancing, wearing face coverings, good hand hygiene. And we must encourage our employees and our customers to practice them diligently for the foreseeable future. And we all need to work together to overcome the twin threats that COVID-19 poses to our health and to our economy. And with that, I'll turn it back over to Tim.
Great, Dr. Raymond. Maybe just one question as we bring Joe in here. As you introduce this new criteria today, one of the challenges people always level on a discussion like this is that we're moving the goalposts. And these really aren't moving the goalposts. This is a better set of goalposts to tell us what we can do today and what we can do as we kind of move into the next normal. Is that a fair way to look at that?
Yeah, Tim, I think it's fair. Maybe we can say we've passed the 50-yard line and our view of the goalpost needs to change. Maybe we're within field goal range.
I like that. Thank you, Dr. Raymond. We're going to pivot here a second and talk to Joe. Joe, you've got extensive experience, both personally and through your organization, Generator, dealing with an important part of our economy, new businesses, startups, and financing. So just as an opening question, through that lens, how has the impact of COVID been on this segment of our economy?
Yeah, we're currently running really two sets of programming, the programming to support our tech startups and healthcare startups, et cetera, and another for more Main Street businesses. And as a result, we've talked with well over 600 Wisconsin-based businesses, not-for-profits, musicians, artists even, over the last 60 days. And it has been jarring to hear both the transition from where people were, on about March 20th to April 20th to now as we're looking towards May. This has been, usually we work with startups, they're not, it's an aspirational event. Currently, it's much more of a reactive, a little spooked event. And so we're seeing the financing markets are tightening. We're seeing that obviously revenue has declined, and that this is sort of an all hands on deck crisis moment for the Wisconsin economy that has drawn our full attention. I suspect the chambers, I know you've been working hard on it, and something that I think is going to take us a long time to recover from, both as a startup community and then even as a Main Street community.
Yeah, you want to take us through a little bit? I know you got a couple slides here just to talk about what Generator does and how you're going about serving companies.
Yeah, absolutely. And I'll say I'm going to go through a few of them, and I'm going to leave a few more in the deck that's shared as a part of this presentation that covers some more of the details. And if people have more questions, we wanted to highlight areas that we'd be happy to try to answer any follow-up on if you're interested in looking at the PDF after. But as an introduction to Generator, co-founded it 8 years ago. As Tim noted, we've invested in nearly 100 startups. They've raised hundreds of millions and employ thousands of people in Wisconsin. We've since grown to a company of about 50 full-time employees across 10 states. in over 20 communities. So while we are a Milwaukee company, a Wisconsin company, we operate from Los Angeles to Toronto to Miami and Puerto Rico right now. So we've really covered the country, both with our startup portfolio and with this new emergency response program. And over the past 8 years, as Tim knows, we've been on the forefront of advocating for more capital to come to Wisconsin through the startup portfolio and through the venture community. And there's lots of work to be done there. I think even more work to be done there as we emerge in the medium and long term from this crisis. But in the very short term, we've built this emergency response plan. It actually came out of the state of Indiana. We're under contract there with the Indiana Economic Development Corporation. And they were looking for a way to respond to the deluge of calls they were getting and wanting to know if we could use our structure of working with startups to help with small businesses in Main Street. So we created this format. It consists of webinars that are really a suite of webinars that are currently on our resource page if anybody wants to find them. We do one-on-one work with each company like we would with a startup, in this case to help them engage the suite of programming available. And then we'll even do proactive calls afterwards to make sure that they're able to confirm those. So that's the core of the emergency response program: content, one-on-one engagement, and then a safety net to make sure you're getting the help you need. Like I said, this started in Indiana. We were lucky to expand into Wisconsin with the American Family Institute for Corporate and Social Impact, as well as the Wisconsin Alumni Research Foundation. And now this has sort of taken off, and we've spent the last 45 days as a company doing these programs for over 5,000 small businesses and musicians and artists and nonprofits across the country. So we've really seen firsthand over the last 45 days this kind of fast and furious news cycle as small businesses and nonprofits have adjusted to an incredibly changed circumstance. And so with that, happy to answer more questions, but hopefully it sets the stage for just what we've been trying to do to help these businesses, whether they be tech startups or dry cleaners and daycare centers, understand the full suite of resources. So it's 14 programs that we've completed. Those programs have 3,800 participants. We're in session with another 3 and are about to do 4 more across the country. We've had over 1,000 one-on-one conversations on everything from deep paycheck protection program or economic injury disaster loan questions to people on the phone, frankly, struggling to find food. It's been a difficult stretch, and it shows you, I think, the stress and duress that the American economy is under, and how quickly we need to get the wheels running again.
Let me ask you a question, Joe. And you've dealt with such a wide variety of companies, from startup to early stage, nonprofit, arts groups. What are the top 2 or 3 things that you're hearing from them that they need?
And it's so news cycle driven. So my answer today versus 4 days ago versus 4 days before that. But at the current time, a lot of the people we're engaging are unsure of where they stand with their Paycheck Protection Program application. They applied sometime when it opened a week or 2 ago. Their bank wasn't able to complete their application to process it completely by the end of the first allocation from the CARES Act running out. And they're not sure whether they're going to be able to get in for the second one. A lot of what happened over the weekend was communications from banks stating that while they have their application, there's no guarantee that it'll be processed before even the second tranche of funding runs out. There's a Politico ran an article saying that the banks had backlogged $50 billion a day of demand. So over the last 6 days, they've built enough to basically completely allocate the fresh $300 billion. It's not implausible that by Tuesday or Wednesday, tomorrow or the day after, we may be out of funding again. And I think a lot of businesses are wondering what happens if they go unsuccessfully through this second window. But that will be a different news cycle in 2 or 3 days. So today we're talking a lot, or we anticipate today talking a lot about how to get to a community bank. Later this week, we anticipate talking a lot about the employee retention tax credit, as well as, frankly, unemployment, even for owner-operated companies.
Yeah. So you've operated in a number of states here. Let me ask you one final question. We'll bring Dr. Raymond in. We'll get questions for both of you from the audience. But you're operating in a number of states. Do you feel like the states that you're operating in are balancing this right in terms of kind of health and safety protections, as well as kind of bringing the economy back online?
Yeah, that's a great question. I want to give kudos to the Milwaukee Chamber, and I sent you a note on this, Tim, weeks ago. We have had experience with a lot of these chambers, a lot of these economic development groups and state departments of commerce or their equivalent. And frankly, we don't see this balanced presentation between the public health aspect and the economic aspect. And I think that's really led to a balanced presentation from you into how to think of this as a business community. And just kudos to you for that. we are seeing, the full range. We want to get up and running again. I think we want to see businesses running again because we've seen firsthand the enormous stress they're under. We've talked in these business conversations, obviously the government orders come up. There's people all over that spectrum, people who are afraid of opening too early and having to close again if the outbreak worsens, and people who are on the other end who are wondering why we haven't opened weeks ago. But what I'll say is the common denominator across those conversations is in a real concern about let's take the government order out of it. What does demand look like in 2 months or 3 months? And whether they're under a government order or not, how can we help them get back to the point where customers feel safe working with them and employees feel safe working there? So we anticipate a lot of our programming in the next 2 to 3 weeks, and I'm sure you guys are on the same path. How do we start working with these businesses to make people feel comfortable going back to work? Because as public polls show, so a large chunk of the population just isn't comfortable going out right now, and that's going to be an economic issue regardless of the work from home dynamic. So that's what we think is on the horizon, and I think you guys have balanced that as well, if not better than any we've seen across the country. So congrats, and please keep doing it.
Yeah, thank you. Very helpful summary. Chris, we've got questions.
Yeah, absolutely. First question for Joe. It's a difficult one. What's the best advice you'd give a startup or an entrepreneur to sort of not give up hope right now?
Yeah, I have had that conversation, and I say that, hey, look, at the end of this, you could say that it won't be worse than this pandemic. You'll reach the peak of it, and you're going to be stronger when you get through it. The most immediate thing we've been doing, a lot of the emergency response came out of guidance we have been sending our founders. Be aggressive in going after the federal programs. I've spoken to a lot of restaurant owners who had basically had to lay off staff before the federal relief and the CARES Act arrived, and they're not aware of the employee retention tax credit, which could even cover them as the operators and owners of the company. It's not as good as the Paycheck Protection Program, but if you don't meet the criteria, it's available to you. And I think as people look harder and harder at these programs, they'll find there are resources available to help them get through the next 2 months. I think in the medium and long term, it's get to your chamber, get to your network. Feel free to call us. And if you sit there and work on the problem of how do you keep enough revenue to stay in business through the next 4 to 5 months, it's not going to be fun, but I suspect that the majority of businesses can come up with a better model, at least one good enough to stay in business through this. But I'm full of humility for people who I know are struggling to buy food right now. So I don't take that question lightly.
Yeah, another question maybe for Tim and Dr. Raymond is about Governor Evers' announcement today that there are some additional easing of the safer at home regulations for non-essential businesses that allow for a little bit more curbside service. What's your view on that?
Go ahead, Dr. Raymond, I'll let you start.
I think it's good. It's very responsible, being phased in, clear guidelines. It's progress.
Yeah, I would agree. Again, I think a measured way in which we can continue to build confidence, to pick up what Joe talked about, to continue to build confidence in employees and the consumer will help that dial move faster. So again, a move in the right direction, and I think we want to see more of it.
Maybe time for one last question. Dr. Raymond, when do you expect Milwaukee area health systems to resume elective surgeries and reopen satellite clinics?
Well, hopefully soon. That's the lifeblood of everything that we do. And I think the main limiting factor still is personal protective equipment. But I know that the health systems want to have a responsible restart, and they're eager to work with the MMAC and with Governor Evers to make sure that happens.
Great, thank you. And thank you to everybody who asked a question today.
Yeah, great, thank you. Dr. Raymond, Joe, I know the time goes fast, but thank you very much for the update and for your insights on the startup community and the small business community. And we're lucky to have you in our backyard, so to speak, Joe. So you can see in the coming week, we've got Amy Linder, who runs the United Way of Greater Milwaukee and Waukesha. Omar Shakish will talk a little bit about the impact on the hospitality industry on Wednesday. And then on Thursday, we're going to talk about the impact of COVID, and we're going to talk about, I think, some of the impact on testing, and then we'll wrap the week up on Friday, hopefully with more good trend data for the entire week. So again, Dr. Raymond, Joe, thank you. Have a very safe rest of your day.
Thanks, Tim. Thanks, Joe.